I'm hoping that tonight is really going to be enlightening for you and give you a few light bulb moments in regard to a very common problem of low back pain. And I've been mingling with the crowd tonight, and I think every doctor that I've talked to tonight has expressed that they see many patients with low back pain. I was fortunate to work closely in multidisciplinary teams with musculoskeletal physicians, pain specialists, physiotherapists, and that taught me a lot about what works for back pain, but more importantly, it taught me what didn't work. And I really started to feel that there were more people that we weren't helping than that we were helping. And it really made me start to think, what are we doing wrong here? And that's what led to the evolution of this centre here, called the Functional Movement Training Centre. Just imagine you're a patient now. You've had pain for 5 odd years. You had a minor injury at work. Over time, this pain relapsed and remitted, but it never really went away. Soon it started to really interfere with your quality of life. You started having to take more and more analgesics. You struggled to work after a couple of years of feeling this constant pain. This of course affects our mental health, our general health. You do the natural things, you go to your GP, you go to a myriad of corner store physical therapists, and there's many out there. Everyone tells you, because you're continuing to fail, you've got persisting pain, that it's because of your worn out discs, it's because you had a heavy work history, you've got a lot of degeneration there. And like any sensible person, you go and get a couple of opinions from surgeons and you eventually have your surgery. Sadly, it fails, as it does in over 50% of back surgeries. And then you finally see me, because it's not the first port of call going and seeing a movement therapist specialist. Now, I ask you this, what disease have you suffered from when you come and see me after 5 years? And I ask every patient that question who has persistent pain. I said, you've got this terrible pain, what is the disease? You've seen numerous therapists, you've seen numerous doctors over a period of 5 years. What's the disease that you have? Do you know that not one person has told me what disease they have? They just tell me that they've got back pain. And that is not a disease, okay? These are all symptoms. The disease that you suffer from is movement dysfunction, and then you look at me a bit puzzled. What do you mean movement dysfunction? Movement dysfunction is the disease that causes the pain. Normal pain-free degeneration transforms into painful degeneritis under the influence of movement dysfunction. Degeneritis is not normal. Our program is called NeuroHab for a specific reason. We are rehabilitating the nervous system. The nervous system is the steering wheel. It's the controller of movement. And I actually think that we can go as far as calling back pain a central nervous system movement disorder, far more than we should be calling it a musculoskeletal problem. It's a central nervous system movement disorder. And if we think about back pain as a central nervous system movement disorder, we now have a light bulb to what do we need to do to cure that disorder. We need to fix the movement disorder. And this is what our patients look like. Again, no couches, okay? Our prime focus is on movement proficiency. It may look like that this is an exercise program, and it may look like we're trying to make people stronger, but we're not. We're actually focusing directly on their brain and spinal cord. It's a coordination program that's teaching people to move properly, and when they move properly, they can do pretty incredible things. So I'm a movement obstructing barrier surgeon. I do my surgery to eliminate movement obstructing barriers so that they can engage in movement therapy. That's the algorithm. That's why I do surgery. The software, or the central nervous system motor pattern fix, is NeuroHab program. And conventional physical therapies is a hardware fix. And generally anti-movement even when exercise is integrated into the program, because the exercise is not focused on the nervous system, the exercise is focused on the muscles. And remember, we said that back pain is a central nervous system movement disorder. And centralisation is the result of not disrupting this movement dysfunction, causing more pain cycle. Treating low back pain with NeuroHab can get the worst of the worst back pain patients into the best of the best athletes.